In the world of thoracic oncology and lung cancer, obviously, there's a lot of emphasis and a lot of excitement about immunotherapy. What we learned this year again at ASCO was that single agent immunotherapy in about 15 to 20% of our patients can actually lead to long-term survival. So this was data presented based on earlier trials with pembrolizumab, where we've tracked patients for 5 years, and now we have actual 5-year survival data for patients with metastatic lung cancer, which is something that we never had with any of the other treatments that we had to offer our patients. Of course, patients with molecularly driven tumors have been able to achieve better survival with targeted therapies, but for the majority of our patients, we haven't had that. Also, what was important and was highlighted at this year's ASCO was the need for the molecular testing of all of our patients with a big panel, what we call next-gen sequencing panels, because pretty clearly you can identify even small subset of patients with what we would call targetable mutations or alterations, for whom we have very specific, well-tolerated, and highly effective drugs that can in fact have a major impact on not only their quality of life, but potentially even their survival. And I say potentially because a lot of these studies are still ongoing, so we don't really know the extent of improvement in survival, but finding the right patient and personalizing the delivery of care to them is only possible if you find these alterations and mutations and offering them the right drug.